Thank you so much for joining me here at the live desk. I am Janae Hancock. Right now, we are going beyond the headlines and focusing on a topic that is really being talked about right now. I want to take a look at this video that you can see here now on your screen. The CDC, they are currently in a meeting right now, working to consider how safe and effective 3 updated COVID-19 vaccines are. Then they will vote on recommendations for who should get those vaccines, and then the CDC director may sign off. Now, with all of that being said, I do want to turn things over to infectious disease pharmacy specialist Sayo Wise, Dr. Sayo Wise with University Health. I want to thank you so much for joining me here at the live desk to talk about this very timely and important topic. I do want to just start off with a quick question for you. So we know that a lot of people are reluctant to get the vaccines. Tell me what you think about that. Let's start off with your initial thoughts.
Yeah, so it is a tool that really helps us to reduce our hospitalization for COVID, as well as really reduce that severe disease, as well as long COVID. And so it's a tool that, as a infectious disease specialist, I hope that more people will utilize, especially now that it's available from 6 months and older. And depending on what CDC decides, we will find out today, hopefully today, who really qualifies for this vaccine today.
And so what route do you think that they are going to go? Or is it going to be just anyone who is 6 months and older, like you said, or is it going to be people who are at risk that they're really going to focus on as far as recommendations go?
Yeah, so that's definitely the part that there's 2 camps to this this debate, and it's going to go exactly as you said. It's going to go everyone, or it's going to be at risk patients only. And it is a little bit hard to see, at least just from the meeting agenda at this point. So we will really see what the meeting has after it concluded, what their opinion is going to be.
And I know a lot of times when we talk about COVID, we talk about the flu, we also mention pregnant women. They should also consider getting those vaccines. But should we also be talking about infants? They are at high risk and they don't have the immune system that they should just yet.
Yeah, so that's a great question. So especially if a pregnant mother gets a COVID vaccine during pregnancy, there is a pretty good chance that the baby, the infants, actually receive the antibody from the mother. And so it's a little bit unlikely that the infants will need a vaccine up till the 6-month point. And so for now, I don't think the CDC will expand its coverage to younger than 6 months.
Okay, and so, we have been talking about COVID-19, the coronavirus pandemic, since 2020 when it really hit in the month of March. And so a lot of people, they have gotten their shots, they have gotten their boosters time and time again. Why is this vaccine, this updated vaccine that they are considering right now in particular, why is it good to get right now?
So the new vaccine, so this new monovalent vaccine is a updated version of the COVID vaccine that we are used to seeing, which has a strain of a Omicron called XBB 1.5, sorry. And so it is a more recent circulating variant. And throughout the United States, there are many different variants that are circulating. However, XBB strains, which has many different numbers if you look these up. However, thankfully, XBB 1.5 is actually pretty similar to many of these circulating strains, so it should give patients a good immunity for protection.
And so we know that cases are going up here lately. What do you suggest? What is your best advice to people going into the fall season, going into the winter season? What do you suggest for them?
Yeah, so for patients who are eligible for the vaccines, flu vaccine, of course, which will be everyone 6 months and older, as well as especially older patients that are eligible for RSV vaccine, as well as COVID vaccine, depending on what the CDC decides. Whatever is available in terms of prevention tool, that is a great tool to prevent yourself from having any severe respiratory disease. Additionally, of course, there are preventative measures like masking, especially if the circulation of the COVID virus is high enough that the local health department deems that the circulation is high, at the risk is high. I think it'll be best to have some of these COVID mitigation measures that we have seen in the last 3 years that has seen to be that we saw to work over and over again, things like masking, washing hands, social distancing. And based on each patient's risk for the severe disease, these mitigation measures should be something that should come back.
And I know, like I mentioned, for the viewers who are just now joining us, the CDC is currently in that meeting discussing the updated COVID-19 vaccine. But do you happen to know, Dr. Wise, how the payments are going to look this time around? Will people have to pay to get the updated booster shot?
Yeah, so that's a great question. So if if most insurances, and of course, I can't speak of every insurances that people have, but most insurances should cover the COVID vaccine based on the preventative measure coverage. And so that should be covered. And if you do not have insurance, there are patient assistance available from both companies as Moderna and Pfizer. And so these are tools that can be utilized, and it is pretty easy to look up on their website for a patient assistance as well.
And so let's say that they do move forward with the 3 COVID updated vaccines. They are expected to come out within the next few days. We can't expect them this week. Does it matter which one you get? I know that there's Moderna, there's also Pfizer. Does it matter which shot you decide to get?
Yeah, so CDC has deemed these vaccines to be interchangeable. So it really doesn't matter if the original vaccine you received was Pfizer or Moderna. Whichever is available to you is it's acceptable to interchange or stick with the same one. So it can be either.
Perfect. Dr. Wise, I want to thank you so much for joining me here at the live desk. I know you have a busy schedule ahead of you. So thank you so much as we continue to wait for the CDC to release their recommendations and whether or not these updated COVID-19 vaccines have been approved. We hope to have more information for you all leading up to our evening newscast, but especially during our 4 p.m. newscast. Be sure to tune in then.